Democratic leaders in Congress are working behind closed doors on a compromise health insurance reform bill. Well, if that bill includes federal funding of abortion, as we suspect it will, it would set a significant and outrageous new precedent. Since the 1970s, no federal Medicaid funds have paid for abortions, and that same principle should apply to this new program, whatever form it eventually takes. I'd rather see no health insurance reform bill at all than a bill that requires federal funding of abortion. And that's why I believe the Stupak amendment, which is part of the House version of the bill, should be in the negotiated final version of the legislation. The abortion industry has long been telling anyone who would listen that the Stupak language would restrict access to abortion for poor women and sacrifice women's rights for the sake of health care. Let's call that what it is, a lie. Stupak wouldn't restrict access to abortion at all. What it would do is make abortion the financial responsibility of the patient, not the taxpayer. President Obama has promised that his health reform bill would not include funding for abortions, and it's time we hold him to that promise. So I hope you'll write and call your elected leaders to tell them that, because as I've told you so many times, our times demand it, our history compels it, our future requires it. And believe me, God is watching. I'm Rod Parsley. That's just one preacher's perspective.